thus impressing happiness and Korea elderly people with cognitive impairment, using data from 29 country health survey. Introduce. Hello, I'm Miyoun, a professor of nursing at FoCoS.IDIC University in Gyeongju, Korea. I will introduce the paper to be presented. This study is investigated effects influencing the happiness of elderly people with cognitive impairment in Korea in 29. I use data from nationwide survey by the Korean Centers for Disease Control and Prevention. A total of 229,099 subjects were surveyed. Among them, the elderly 65 years of age or older were selected, and subjects with cognitive impairment were studied. Flow diagram. Research purpose. In the world population, prospect and numbers of people aged 65 and over will increase from 19.1% in 29 to 18.6% in 2016-7. In 29, the elderly population in Chinese world was 11.5%. The United States was 16.2%, and Korean was 14.9%. Older adult, the communications physically and psychologically as age increases. Cognitive impairment in old age is a typical symptom of dementia in elderly. Cognitive disorder account for 29.4% of the elderly in Korea. Factors that impact happiness according to their daily life and health activities were analyzed. The specific purpose is as follows. 1. To understand the general characteristics and health status of the elderly in Korea with cognitive impairment. 2. The difference in happiness according to the general characteristics and health status of the elderly in Korea with cognitive impairment is investigated. 3. Factors affecting the happiness of the elderly in Korea with cognitive impairment. Next, study materials of subject. Using data from the Korea Center for Disease Control and Prevention's 29 Community Health Survey. This study was conducted through cooperation between 17 cities and provinces in Korea and 255 public health centers and 35 responsible universities. The primary sample size was based on an average of 900 people per public health center. For the second sample, household extraction and phylogenetic extraction were used. The survey period was from August 29 to October 31, 29. The trained researcher used the laptop equipped with the questionnaire program. The researcher conducted a one-to-one face-to-face electronic questionnaire. The total survey question consisted for 211 items in 21 areas. The subject of this study was 65 years old with cognitive impairment. Cases without cognitive impairment and no responses were excluded from the analysis. Next. Study variables. Demographic sociogenical characteristics. Population sociological characteristics were analyzed for gender, age, education level, economic activity, monthly income, and spouse status. Happiness indices, quality of life. This is one question. The evaluation satisfaction was recent life. All satisfaction was rated as 10 points and very dissatisfied as 1 point. Next, quality of life EQ5D index. 1. Athletic ability. 2. Self-care. 3. Daily activities. 4. Pain discomfort. 5. Anxious depression. The other stress level, following experience. Ethical consideration. The survey was conducted on nationally representative sample. I guessed the data from the Korea Centers for Disease Control and Prevention. To receive the data, I signed the pledge of use. I consented to the collection and use personal information. I submit the data using the plan the requested. No personal identifiable information were collected in the data, so no ethical approval was required. Through his process, the total of 229,099 samples were received from in the Korean Centers for Disease Control and Prevention. Next, data analysis. All statistical analysis use SPSS version 25.0. Frequency analysis based on general characteristics use percentage. Interlevel difference of verification used the t-test ANOVA. Post-analysis of ANOVA tests the homogeneity array of variance when the intergraph difference were significant. Then, assuming the equivalence, I analyzed it with the CFA. If equivalence is not assumed. First analysis performed with DUNET T3. Interface regulation was conducted of verify the factors affecting happiness. Next. Research result. The general characteristics of the subject. The characteristics of the subject were 63.5% of female seniors and 47.9% of those under 74 years of age. As for the education level, 81.7% of those with middle school graduation or low were the most numerous, and 65.9% of them did not have economic activities. For 15% of subjects, monthly household income is less than 1 million won, and a higher income of more than 3 million won was surveyed was low as 19.7%. 57.8% of subjects had scopes. EQ5D and independent variable of modeling quality of life was measured. 54.1% said athletic activity was uncomfortable. Self-care was possible in 76.6%. In daily activity was 15.7.8%, answered that there was no problem. 55 reported slight pain and discomfort, and 12.2% reported very severe pain and discomfort. 68.1% report no anxious depression. 66.6% report feeling stress. 75.7% report no fall experience. Subjective happiness is 49.8% for moderate and 41.8% for high. Next. Table 1, general characteristics of the subject. 2. Difference in happiness according to the two general characteristics. The difference between other variables in degree of happiness was analyzed by t-test and ANOVA. Males saw the higher happiness index than female. Their younger age and higher education showed a significant difference in happiness. There was a significant difference in economic activity and the higher monthly household income. The process of spoon made a significant difference. There are 5 categories of EQ5D to evaluate quality of life: athletic ability, self-care, daily activity, pain, discomfort, anxious depression was significant. And it was significant when the stress level was low and when there was no experience of feeling. Next, table 2. Difference in happiness according to the general characteristics. 3. Factors affecting the happiness of the cognitive impairment of elderly. The explanatory power R2 of the variables input to the analysis model was significant at 25.5%. Age was not significant. Gender, education level, economic activity, monthly household income, spouse, and statistically significant. Athletic ability, self-care, daily activities, pain discomfort, and anxious depression was significant. Stress level and fall experience was significant and analyzed as factors affecting the happiness of the elderly with cognitive impairment. Next, Table 3, impact on the subject sense of happiness. Next, discussion. For this study, data from Korean Center of Disease Control of Prevention's Control Health Survey was used. This study was conducted in Korean elderly with cognitive impairment. The factors causing the happiness of the subject were identified. It was hoped that the elderly Koreans live a full and happy life. That 29.4% of the elderly in Korea have cognitive impairment is serious situation. Korea was the elderly population in the refectory inclusion. Need deep considerations. Older Koreans went to live separately from their child. The reason is change the values and urbanization that support parents. Elderly Korean normal had a higher sense of happiness than female seniors. This related to the economic activity and income of the elderly male. Next. The 5 item of EQ5D, ability of athletic ability and self-care, daily activities, pain discomfort, and anxious depression, and happiness in the elderly. It is good to be able to go wherever you want and to be able to take care for yourself. Therefore, there must be activity in their daily lives. Degeneration disease in elderly cause pain and discomfort. Pain is associated with depression and reduced quality of life. The happiness is less way. Therefore, nursing and self-management are necessary. Elderly stress are affecting quality of life. There is need to method to with the successful aging by controlling the stress of the elderly. People with the cognitive impairment are more likely to fall. Falling experience case anxieties. In particularly when the decided elderly have low athletic ability or pain discomfort and the number of fall increases. Aging is experienced by everyone at some point in life. Individuals and their families endeavor to improve the quality of life of the elderly. And the government and local community must work together. We should try to make the better society for the elderly. Next, conclusion. The pursuit of happiness in older adults with cognitive impairment in the important light. The impact factors should be investigated to improve the quality of life to the elderly. It is also impairment for the subject to take care of their one's health due to normal aging. The management of chronic disease will enhance a sense of well-being. Regular health care, the unable ability keep the elderly healthy. However, economic activity or income of the elderly requires of a national policy. There is need to national policy such as job for senior citizens and pension to suit their abilities. Regular activities and programs for senior citizens should be activated around the welfare center for senior citizens. Counseling community should be activated the relief depression such as loneliness. Therefore, all environment should continue to promote the happiness of all the adults with cognitive impairment. The research methods was conducted nationwide in Korea and made available to the public in 29 community health survey data. It is cross-sectional study to the nature of the data. So there is limitation in there. It has not been analyzed in depth. Follow-up studies need to be carried out to improve the happiness of older adults with cognitive impairment. Thank you.